Hi everyone, I'm Colleen and I'm back for another live stream. Today's topic, we're talking about the biggest challenges dental assistants face. So if you're thinking about a career as a dental assistant or you're brand new to being a dental assistant, maybe a year of experience or less, you've probably heard or experienced some of the pros of being a dental assistant, right? You know some of the advantages of dental assisting, but have you talked about some of the challenges that you can face, or do you know what those are? Well, you're in luck because today that's what we're going to be talking about. We're going to be talking about some of the biggest challenges that dental assistants face and our tips for working through those challenges, okay? But before we dive into that, I just want to remind everyone that this stream and these weekly streams are brought to you by Princess Dental Staffing, okay? Princess Dental Staffing is an online dental job board, and they offer positions for front office personnel, dental hygienists, dentists, and yes, dental assistants as well, full-time, part-time, permanent, temporary, all kinds of different positions. So if you have a chance today, hop on to princessdentalstaffing.com and take a look at their job board, see what positions are available in your area. You can also create a profile and get your information in front of the decision makers, the hiring managers as well, and let them know what a star you are. Additionally, you can also check out their blog. So they have a blog that covers a lot of the same topics that we cover in these weekly streams. Okay, so you can check that out as well. By the way, these streams, again, they're brought to you weekly on Wednesday. Each week, we're covering a new topic about your career in the dental industry. If you don't want to miss out on future streams, be sure to subscribe to our channel or follow our page. If you have any thoughts, comments, insights, or information on any of the topics that we're bringing you, be sure to comment below. And if you like the topics that we're bringing you and the things that we're discussing, drop us a like. Okay? All right, so biggest challenges for dental assistants. So, you know, with any industry, any position, really anywhere that you work, of course, you're going to have some challenges that you face and some cons of, you know, that kind of work or in working in that industry. Dental assisting is no different. So we're going to be talking about those, and we're going to be giving you tips on how to work through and overcome some of those challenges. Okay, so coming in first is inner office politics, okay? So if you've ever started at a new dental office, you probably have experienced this kind of learning curve, right? Just kind of learning about the team members, how things work, and how the team members kind of interact with each other. You know, it also may take you some time to learn sort of some of the unspoken rules of the office. For example, you know, who's typically in charge or who's leading, you know, certain processes or operations, who's the authority figure regardless of position, who's kind of the subject matter expert, right? Usually the person that's been there the longest, who's kind of always open to help or to offer some assistance, how to interact with each individual and a little bit about their backgrounds maybe. So a lot of different things that, you know, you don't know coming in that everyone else probably already does, okay? Additionally, where you're coming into a new team, again, you don't really know those individual team members. And, you know, it's quite possible that some of those team members have been there for years and have already built and cultivated strong working relationships with one another, maybe even have some deep friendships outside of the office as well. And of course, you're not really going to know that as a newbie just coming in, right? Okay, so when it comes to sort of those inner office politics, and before you, you know, have a good layout and know kind of what's what, our recommendation is that you play it safe until you have a better idea of the inner office politics and how everyone works with each other and how the team works, okay? So basically just try not to stir the pot, so to speak, okay? If you have an issue with someone or with, you know, something like a process or something like that, make sure to try to speak about it calmly, in a calm tone, Okay, again, you're still getting used to everything, so you want to make sure that you approach each situation from a calm standpoint. Okay, and with the focus on resolving the issue as opposed to assigning blame. Okay, and when in doubt, you can always ask your supervisor for help or assistance. So unless the supervisor, like the office manager or the dentist or whoever, unless they're brand new, they've probably been there, they've probably been in that office maybe for several months, maybe for several years, and they've probably had to bring on new employees, new team members multiple times. Okay, likely, right? Unless they're brand new. So they probably have an idea of some of the common issues that new dental assistants run into and how to kind of help navigate those issues. Okay, so they can be a really great resource to kind of help you work through some of those issues that come up with interoffice politics. Okay. Number 2, managing stress. So of course, like I said earlier, every job has its stress, right? Has its unique kind of stress and, things that can really inhibit, a positive attitude, right? Just really, stressful situations. Okay, and a dental assistant, of course, is no different, right? But being a dental assistant, you definitely have some unique stressors, right? That are unique to being a dental assistant. For example, you as a dental assistant, you're working with consumers, clients, customers, patients, right? Very patient or very customer facing position, but you're also, providing a skilled service as well. So having to balance both of those things can be stressful in and of itself, just kind of balancing that pleasant customer service with working professionals every single day, a diverse set of working professionals every single day, right? Everyone needs to get their teeth taken care of and looked at, right? So that can be very stressful in and of itself. Something else is working long hours, right? So if you are, if you're a full-time dental assistant, you're probably at some point going to have to put in some extra hours or work a few extra shifts or extra days as the office needs it. Maybe somebody, vacated and they need a little bit of extra help from everyone and everyone has to pitch in, something like that. But you're likely going to be working long hours if you're a full-time employee, okay? And one of the things that can be stressful about working long hours is the fact that you as a dental assistant, you're going to be on your feet most of the time, right? You're going to be walking around from room to room and, from, the front of the office to the back of the office and that sort of thing. You might be, kind of leaning over, reaching for things and all that kind of stuff. And that can put a lot of stress and strain on your body, okay, and can lead to physical pain. So make sure that you're, wearing comfortable shoes, that they're not too worn, that they're giving you the correct arch support and that kind of thing, because you're going to be spending a lot of time on your feet. So make sure that you've got the support that you need from the base up so that, you can get done what you need to get done. Additionally, be sure to be on the lookout for wrist issues, carpal tunnel, and that kind of thing. That, is sort of common among dental assistants, a common injury. So make sure that you're watching out for that and that you're tuning into your body and that you are paying attention to those kinds of warning signs of wrist injuries and carpal tunnel, so that you can kind of head it off at the pass and not work yourself too much to where you get lasting damage. Okay, because that definitely would be not something good, right? It's definitely what we want to avoid, right? Additionally, working long hours could mean burnout as well, which is a very real thing, and it's something that can really affect your service, right? Your patient service and your ability to perform your job duties, etc. So make sure that your working hours are the exception, not the rule, right? Not the norm, okay? It's just something that you do occasionally when the office needs it. Somebody called out or somebody left the practice or something like that. And this is really for your sake, right? It's for your sake so that you can make sure that you're not getting burnt out, okay? But if you do feel the signs of burnout when you start, sort of feeling tired or feeling irritable or that sort of thing, make sure you talk to your office manager. Let them know that you're feeling a little bit burnt out and that your work product may be suffering due to your burnout. And of course, set yourself up for success. If you know you're going to be working long hours, make sure that you're still taking time to take care of yourself. We've done we've done tons and tons of streams and videos on taking care of yourself if you are someone who is in the dental industry. Excuse me. Such as make sure you're getting your 7 to 9 hours of sleep at night, that you're leaving work at work, and that you're, engaging in home at home, that you are, eating a healthy diet, that you're drinking your water, that you are engaging in positive exercise, right? The type of exercise that you feel good about and that you look forward to, right? And that gives you those good, happy endorphins. And then also make sure that you're taking breaks throughout the day, especially if you're working a long shift or extra shifts. Make sure that you're taking anywhere from 1 to 5 minutes a day to kind of check in with yourself and to, to calm yourself and bring yourself back to a stable state, right? Do some breathing exercises, maybe watch a visual meditation video on your phone if you can have your phone, or something like that, okay? All right, set yourself up for success, and that's really going to help you manage your stress. Okay. Number 3, patients that don't respect your time. So, when it comes to patients that don't respect your time, that could be a lot of different things. For example, last-minute cancellations, which can actually throw off a lot of your day, right? And it can throw off a lot of your planning, especially if you're one of those dental assistants who takes time in the morning to kind of plan out the day. A cancellation can really throw a wrench into all of that, right? And it can also mean that you have multiple hours throughout the day where you don't have anything to do, and a lot of space filled with, nothing, because you had one or multiple patients kind of call out, right? And actually some offices, if there's nothing for you to do, they'll actually send you home, which can actually hurt your paycheck, right? Which, is just not the best thing. So it, especially if you're not salaried, it can actually affect your paycheck. So, not a great thing all around. It happens, but sometimes it can really kind of, like I said, throw a wrench in things. Sometimes they come in late as well. Sometimes they're late for their appointment. Assuming that their time is more important than yours, so they come in late. And depending on the office that you're working in, if your patient comes in late, they might turn him away, try to reschedule him for another time when they have time to actually see the patient. Or you may still have to work on the patient, but you're just going to kind of have to hurry up in order to accommodate the other patients throughout the day. And again, that can really throw a wrench into your daily operations and have you feeling a little bit stressed out and overwhelmed because you're having to play catch up, right? So it just really, it can, patients being late or not coming in at all, last minute cancellations, no calls, no shows, those sorts of things can really disrupt the entire flow of your day. Okay. So when it comes to this challenge, one important thing to remember is that, when it comes to patient not respecting your time, it's not necessarily that they're not respecting your time. The thing is, you don't know what's going on in the patient's life. Maybe they were late for, a good reason. You don't know. Or maybe, maybe they just accidentally forgot about the appointment, or maybe there was bad traffic, or last minute cancellation, maybe they had a death in the family or something. You never know. So it's important to remind yourself that this idea that patients, and of course there are going to be patients who think that their time is more valuable than yours. Of course there are, but a lot of the times you don't really know that for sure. So it's important to remind yourself that, okay, well, if they came in late or if they have a last minute cancellation, it could have very well been for a good reason. And that will kind of keep your emotions in check about what's happening. Another thing that you can do to kind of help make sure that you minimize last minute cancellations or tardiness from your patients is to follow up the patient a few days before the appointment and remind them that they have an appointment on this day and this time. Okay, a lot of patients make appointments 6 months out, and even if you give them the little appointment cards and things like that, sometimes they just don't remember, and a lot of things happen in 6 months, so maybe they just they thought they could make it and now they can't. Okay, so make sure you're following up with them just a few days, 2 or 3 days beforehand, to kind of help remind them that they have an appointment coming up. And that way, if they do have to cancel, so if you send them the reminder and they have to cancel, that gives you a little bit more time to hopefully fill the space with another patient who would like to be seen. Okay. All right. And lastly, number 4, communication. So communication is important, again, in just about any industry, right? Miscommunications can really lead to, a lot of mayhem, right? It can lead to work being done multiple times. It can lead to a lot of confusion when it comes to patients and patient care and processes. So miscommunication can really, just like, having patients who cancel at the last minute or they're late, miscommunication can also really disrupt your day, very significantly, okay, and really impact kind of the office operations. So communication is super, super important. You're going to be working with dentists, patients, dental hygienists, front office team members on a regular basis, on a daily basis, and constantly multiple times throughout the day. So it's really important to have those strong communications to help facilitate those office processes. Okay. It's also really important to know how each of those positions that you're working with, how they work and what they're responsible for, right? You don't necessarily have to be able to do them yourself, right? You're only responsible for you and your dental assistant, but it's really important to know what everyone else is doing and how, all the puzzle pieces kind of work together so that you know who to talk to when about what, okay? And that will really help fortify your communications as well, okay? It's also really important to have a positive attitude. Negative attitudes are very, very contagious, and they can really affect the entire team and the entire office. But positive attitudes are just as contagious. So having a positive attitude, communicating in a positive manner, is a really great way to, again, help facilitate those office operations and make sure everything goes much smoother. Okay. All right, so those are some of the biggest challenges that dental assistants face and how to kind of help navigate those. Let's recap them real quick. Number 1, interoffice politics. If you're brand new to the office, you're probably not going to have a good idea of interoffice politics and how those things, how everyone and the team kind of works together. So if you're having trouble kind of navigating that, make sure that you don't stir the pot or make it worse. And also make sure that you are communicating calmly about issues that you run into. And if all else fails, talk to your supervision and see if they can't help you out in working through some of those issues. Number 2, managing stress. So every position, every industry has its own kind of unique stress. When it comes to dental assisting, some of that stress might stem from the long hours that you're likely going to have to work at some point, especially when you're on your feet all day. Make sure that you are setting yourself up to be comfortable and safe when it comes to the manual parts of your job, walking around a lot, working in patients, leaning over, bending over, and those sorts of things. And make sure you watch out for signs of wrist issues and carpal tunnel as well. Also help manage your burnout. Set yourself up for success. Sleeping, eating well, good exercise, drinking your water, taking breaks throughout the day. And if you are feeling burnout, make sure you talk to your to your manager, and see if you guys can't come up with a solution together that will help you kind of alleviate some of that burnout. Number 3, patients that don't respect your time. So you're going to have cancellations. You're going to have late patients. What's important to remember is that not all of those, it's probably not all of those patients, or probably most of those patients, it's not about being disrespectful of your time. It's just that they have things going on in their lives as well. But it also affects you as well. So again, set yourself up for success by following up with patients a few days up to a week prior to their appointment, in order to remind them, so that you help reduce no-call, no-shows, late cancellations, and late patients as well. And that way, a few days up to a week before, if they do have to cancel, you can permanently fill in that time with another patient. Okay. And lastly, number 4, communication. Miscommunication can really be a downer, and it can really disrupt your day. So make sure that you're communicating well with not only your patients, but with your team members as well. Make sure you take the time to understand what each team member does, and how the office works together as a whole, so that you know who to talk to when and about what, and make sure that you're using those positive communications, and keeping those lines of communication open to help facilitate those operations. Okay. All right. So thanks for tuning in today with me, everyone. We will be back next week with another topic, going over or talking about your career in the dental industry. In the meantime, have a great week. Have a great weekend. Start enjoying this fall weather. I hope that you're getting fall weather where you are. I know we're starting to. So it's getting there. Fall's almost here. Well, technically is here, but the weather is almost catching up as well. So I really hope that you're enjoying that. In the meantime, have a great week. Have a great weekend. Continue to stay safe out there, and I'll see you next week. All right, bye.